Hi all, this is Loralee Kapp, a Solutions Manager with Managed Outsource Solutions. Today I want to talk to you about what are CPT Code modifiers and how they are used. For a list of commonly used CPT Code modifiers, please see the attached article at the end of this podcast. Modifiers are codes that provide additional information about a procedure. They are added to CPT or HCPCS codes to communicate certain circumstances regarding the performance of a procedure or service. Appending the correct modifier to provide more specificity to payers about the service or procedure rendered will facilitate appropriate reimbursement. Likewise, an incorrectly used medical billing modifier on a claim will lead to denials. Experienced providers of medical billing and medical coding services can help practices file clean claims by assigning the correct codes and modifiers to support the services rendered. As we know, CPT codes are 5-digit numbers and primarily used in office and outpatient settings to report medical procedures and services and claims submitted to insurance companies. These codes are assigned based upon the physician's documentation in the medical record. Modifiers provide a way to convey specific circumstances related to the performance of a procedure or service. The two broad types of modifiers used in medical billing are Level 1 modifiers. Level 1 CPT modifiers consist of 2 digits and are maintained by the American Medical Association. Level 2 modifiers, or HCPCS modifiers, are alphanumeric or have 2 letters and maintained by the Center of Medicare and Medicaid Services. Specifically, a modifier provides the mechanism to report or indicate that a service or procedure has been performed and altered by some specific circumstance without changing the meaning of the CPT code. Provide additional information about the service that has been performed more than one time or services that have occurred unusually. Provide details not included in a code descriptor to report codes in connection with specific payer programs. CPT lists additional situations when a modifier may be appropriate. The service or procedure has both professional and technical components. More than one provider performed the service or procedure. More than one location was involved. A service or procedure was increased or reduced in comparison to what the code typically requires. The procedure was bilateral. The service or procedure was provided to a patient more than once. Ensure accurate medical billing and coding with professional support. The AMA publishes CPT coding guidelines each year on coding specific procedures and services. Proper use of modifiers is crucial for accurate coding and also because many modifiers impact providers' reimbursement. Not using a modifier or using the wrong modifier can result in claim denials and lead to rework, payment delays, and potential reimbursement loss. Incorrect use of a modifier can also result in excess of the amount payable for a service rendered or receiving payment when payment is not due, which, if not reported by the practice, can lead to heavy fines and penalties. Getting professional support can go a long way in ensuring that billing and coding cycle runs smoothly. Top medical billing companies have expert coders who are knowledgeable about CPT codes and modifiers and can help physicians report their services with the utmost specificity. They will ensure that modifier codes are reported only when they are relevant and supported by specific documentation in the patient's medical record.